Today I'm going to give you an informative speech about coronary artery disease and its risks. And at the end, you'll be more knowledgeable about the anatomy and physiology of the heart, as well as the cause and effects of coronary artery disease and some treatments for coronary artery disease. Although some causes are genetically, ethnically, and by age predisposed to coronary artery disease, many causes are preventable. It is coronary artery disease is a narrowing of the small blood vessels of the heart that supply blood, therefore oxygen, to the heart muscle. According to an article from Men's Health magazine titled Men's Health Consulting, coronary artery disease kills 1.5 times more men than women. According to the American Heart Association, in an article titled Understanding the Risk for a Heart Attack, it's the #1 killer for both sexes. Most people think that coronary artery disease is an old people's disease. It's not. It's the #1 killer of women between the ages of 45 and 64, and the #3 killer for women between the ages of 25 and 44. Although according to the survey that we took, 55% of you have had family members that have had heart attacks. Very few of you have had family members that have been diagnosed with coronary artery disease or that have had to undergo bypass surgery. Treatments for coronary artery disease have evolved over the years from minimally invasive to open heart surgery. Although there are many things that you can't prevent that predispose you to coronary artery disease, there are many things that you can. Having been an operating nurse for the past 20-something years, I've had and dealt with open heart surgery. I've dealt with a lot of people who have undergone these procedures, from minimally invasive angioplasties to open heart procedures themselves. So today, I would like to inform you about the anatomy and physiology of the heart and the blood vessels, blood supply to the heart, define coronary artery disease, and talk about who's at the greatest risk for coronary artery disease, help give you some health tips for hopefully preventing or at least decreasing your risk factors. According to an article titled Valves of the Heart by the Department of Cardiothoracic Surgery at the University of Southern California, the heart is made up of 4 chambers and 4 valves. There's 2 atria and 2 ventricles. And the atria bring blood into the heart, and the ventricles push blood out of the heart. There are also 4 valves within the heart itself. The 4 valves are the tricuspid valve between the right atria and the right ventricle. The mitral valve is between the left atria and the left ventricle. The pulmonary valve is between the right ventricle and the pulmonary artery. And the aortic valve is between the left ventricle and the aorta. This valve is very important. It prevents blood from coming back into the heart, although all the valves are very important. They all need to work together in unison for the heart to work properly. As I mentioned before, you have pulmonary arteries and you have pulmonary veins. And the pulmonary artery in your heart is the only artery that carries unoxygenated blood. It takes the blood from the heart, brings it to the lungs. Then the pulmonary veins pick up that oxygenated blood and bring it back to the heart. Pulmonary vein is the only vein in the body that carries oxygenated blood. All of your other veins carry unoxygenated blood. So everything has to work at the same time. Everything has to work together. And now that you know a little bit about the heart and the blood supply to the heart, let's discuss some of the risk factors that go along with coronary artery disease. And according to the U.S. Library on the United States Library of Medicine, in an article titled Coronary Artery Disease from May 2011, coronary artery disease is defined as the narrowing of arteries in the heart also known as atherosclerosis or hardening of the arteries. Causes of hardening of the arteries or coronary artery disease are a buildup of fat deposits from cholesterol, and the buildup of the deposits include the vessels narrowing the flow of blood, therefore decreasing the oxygen. When you have decrease in oxygen to your heart muscle, you have a heart attack. That's what that is. So, along with all these causes, there are also different levels of causes, three categories of causes, if you will. And the categories of causes can be either major, risks that you can't change, or such as your age, your gender. Men are more predisposed to getting it than premenopausal women, although postmenopausal women are at just as much of a risk as men are. Genetics play a big part in coronary artery disease, as well as your ethnicity. Sorry, African Americans, Mexican Americans, and American Indians are more likely to suffer from coronary artery disease. So those are risks that are major. There are contributing risks as well. If someone has high blood pressure, if someone has diabetes, these are risks that increase your likelihood of getting coronary artery disease. And lastly, there's modifiable or behavioral risks, such as being obese, lacking exercise, smoking, stress, drug use. All of these things contribute and can ensure that someone could get coronary artery disease. So whether or not your risks are modifiable or non-modifiable, there are treatments that are available. And according to an article from the Mayo Clinic titled Coronary Artery Disease Treatments, the treatments are based on the level of your disease. So if you have if your level of disease warrants medication, you might be told to take omega-3s. You could be put on a low-dose aspirin every day, or you could get statin medications. Statin medications decrease the cholesterol in your blood. If you have other contributing factors such as high blood pressure, you could be put on medication. Diabetes, you might be given insulin. And both of these contributing risks will have some diet ramifications with it too. You can decrease your salt intake, decrease your sugar intake, to hopefully lessen the likelihood of you getting this disease. But obviously, if once you're diagnosed with it, if you need intervention, there are several means of intervention. Medication, diet control, intervention surgically would be an angioplasty, where a catheter is placed in the artery, a balloon is inflated, left there for a little bit, deflated, and then removed. Hopefully the plaque is pushed against the walls and it stays there. The next step would be a stent placement, where kind of the same procedure, where they put a stent into the artery. The stent is deployed, so to speak, and it stays there, and hopefully keeping that artery open. The worst case scenario, you're going to need to have some bypass surgery, either minimally invasively or through an open heart procedure, where your sternum is opened and your heart and your arteries are exposed. So obviously, it's frightening. Coronary artery disease and is frightening, to say the least. So, but you can do things to decrease your risk. According to the American Heart Association, in a journal article titled Obesity, there are a number of ways that you can decrease your risk for coronary artery disease. Number one would be maintaining a healthy weight, maintaining a healthy BMI. Although it's controversial, less than 20% BMI for women, less than 25% BMI for men gives you the best heart protection. If you smoke, stop smoking, quit smoking. Obviously, it has lots of detriments to your health. And eat healthy, high fiber, low fats. Doctors recommend less than 200 milligrams of cholesterol a day, as well as between 25 and 35% of your calories coming from fat, no more than that. Exercise 30 minutes a day, that's the best thing you can do for yourself. It releases stress as well as helps you lose weight and all those other things. And lastly is reducing stress by meditation, deep breathing, yoga. Stress is a major factor as well, and coronary artery disease. So, in conclusion, we've discussed the anatomy of the heart and explained to you the blood supply and informed you about what coronary artery disease is, the definition of it, the risks and treatments that you can receive, as well as ways to prevent it. So it's my hope that you'll utilize the information that I've given you and and try to have some lifestyle modifications if that's what you need to do. And hopefully you'll have a more fruitful and healthy life. Thank you.